Depends on the person, depends on the method, depends on the brand, it depends on many things. It's not like, oh, we've said that, oh, so many side effects, I'm not gonna do implants anymore. No, we're just wanting that this could happen. ก็แบบเหมือนเป็นความเสี่ยงให้เขาไปแบบให้แบบเป็นความเสี่ยงประกอบการประเมินเลือกใช้ I used to evaluate your decision that if you want to do the implants or you want to do the oral contraceptive. Well, how do we actually use it correctly? Because you talked to me earlier that there are some people who write it down on the internet.
Yes.
That do I have to use it like this? Can I use it like that?
Yes.
Can I put it over the testicles? Yeah, there's so many questions, and we want to give the information for the viewers, especially the male viewers, of course. Welcome to PharmaTalk Podcast, brought to you by pharmacy students. Hi, my name is Gan, and I'll be the moderator also for this episode. And here are my friends, Nisha and Om.
Hello.
And for today's episode, I want to ask you guys that are you excited about today's topic?
Yeah.
So.
Okay.
So when here, oh, you're not excited?
You excited?
A little bit, you
I
know.
think the audience.
The audience wants to know.
Yes,
Yeah.
because so that's why they click in this video.
It's going to be about oral contraceptives and condoms.
Yes.
Wow. The reason we chose this topic because we see the importance of condoms and oral contraceptives in today's time. It's very near us. คืออยู่รอบตัวเราเลย It's nothing far, and we want to share our knowledge with you guys so you guys can use it correctly and safely. Right?
Yeah, it's very important.
It's very, very important. Correct. So first, let's start with oral contraceptives. I think this is well, boys don't usually eat this, right? they don't take it. So I think this is for ladies, who wants to know how to use it, and also maybe for the boys who want to help their girlfriend.
Also, like the pharmacist.
Pharmacist.
Like, you have to know. And there are three main types of oral contraceptives. First one is oral contraceptives that can be taken instantly after sexual intercourse. Like the name of it is emergency pills. Second one is single hormones oral contraceptives. And the third one is mixed hormones oral contraceptives.
So there are mainly three types.
Three types.
Okay, so basically oral contraceptives is a temporary birth control. So there are two kind of birth controls that you could do is for women is a temporary, which is taking oral contraceptives, or the other one is permanent, which is tamman. We call it tamman, right? Yeah.
But
so
today we will not talk about tamman. Maybe the episode will be long, very long. Like.
So we're gonna talk about oral contraceptives. Because there are mainly three types, right? How do you take emergency pills?
For these pills, emergency pills are used for prevention of pregnancy after sexual intercourse. However, it is not used for female sterilization. Moreover, it should not be used regularly. We use emergency pill in emergency case only.
เหมือนชื่อ like the name emergency only.
Emergency. Due to the high amount of hormones contained in the pills. This can lead to unwanted adverse effects and nausea vomiting. In normal contraceptive, it contains only few minutes of hormones in unit micrograms, like levonorgestrel, micrograms, something like that. But in the emergency pills, we contains in unit milligrams. Yes, the active pharmaceutical ingredients in these pills are called levonorgestrel. In Thailand, we use levonorgestrel. This is progesterone. And it's progesterone that modified the structures. It has the strength which are 0.75 milligrams and 1.5 milligrams. Unit is milligrams. But in the normal contraceptive is micrograms. For the pill containing 0.775 milligrams. It must taken together altogether two pills with a duration of 12 hours between each pill. There are two pills. And
คือจะมีแค่ two pills.
Two pills.
ทั้งแผงมี two pills.
Yes, two pills. And you each interval is 12 hours
กินห่างกัน12ชั่วโมง
yes
right.
กินห่างกัน12ชั่วโมง after sexual intercourse
right
but the problem is someone forgot to take another pill take first pill and forgot to take another pill within 12 hours so this prevention is failed the problem is solved by the pill containing 1.5 milligrams of progesterone. It must be taken only once. Both must be taken instantly after sexual intercourse within 72 hours, 3 days.
3 days.
3 days after sexual intercourse. But the pill contains 1.5 milligrams. It's only once taken, but adverse effect is increasing.
Because you have to take it like in a big amount at one time, not separated into 2 times.
Yes.
So now we've talked about emergency pills. Or how do we take single hormone oral contraceptives? Do we take it like same as the emergency one, or
No.
differently?
It different from the like แบบแค่หน้าตาแผงก็ต่างกันแล้ว
The amount of
the amount and the numbers of the pills is different. So single hormones oral contraceptives contain only progesterone. It does not contain estrogen. Yeah, the efficacy is not as strong as the mixed one. So Om will talk about the mixed one, and this is used women who cannot use estrogen, which is when they have light amount of bleeding once taking it. Yeah, but in condition of some people, some female who cannot use something that contain estrogen. Yes, and single hormones oral contraceptives packs will contain 28 pills, and all of them are hormones pills. Starting from the first pack, it should be started during the first 5 days of menstrual cycle. Then take 1 pill per day after finishing the first pack, and after that the second pack can be continued instantly without any conditions.
Nisha said we should start the pack in the first 5 days of men's cycle. Our instructor, the pharmacist, advised that we should take the first tablet in the first day of men's cycle, not first 5 days. For sure that is effective.
Yes. So it's better than count the day.
Yes. If you forgot within 5 days, it's failed.
We have to take it like more than the emergency pills, right? Emergency pills, we only have like either 1 or 2 pills, but here we have about how many pills? 28, right? 28 pills. Yeah. And so we've talked about the single one. And how about the mixed hormones? How do we take it as same as the single hormones?
The mixed hormone, this pill contains both of progesterone and estrogen. It is separate into subtypes. The first one is 21 pills. Once you finish the pack, you must wait for 7 days before you get the new pack. Menstrual cycle, 28 days, right? The pill have 21 pills. So 7 days, you need to free of hormones, and you start after 7 days. The second is 28 pills. This is a bit different than the 21 pills, which can be taken instantly after first pack is finished. But there are going to be some side effects, which are nausea, vomiting, breast pain, headaches, increased weight, and melisma. Light bleeding can be caused by taking the oral contraceptive regularly, which can be solved by taking it at the same time every single day. Why we separate in 2 types? It depends on amount of hormones. 21 pills contains much of hormone than 28 pill.
Since there's only like 21, right? So there's going to
Yes.
be more hormones than the 28 one.
This relates to side effects. If you take 21 pill, it's more is It's a much of hormone, each month of side effect, something like that. So the pharmacist will manage, will listen to your complaint about the side effects, and the pharmacist will change or doctor will change the drugs to for you.
So as you can see, like emergency pills and single and mixed hormones pills are taken very differently. Emergency pills we could just take it after sex, right? But when it comes to a mixed hormone or a single hormone, you need a lot of you need to keep track of your days. คือต้องนับวันต้องดูเวลาจริงๆ you cannot really get lost because if you like get lost or you don't do as the prescription says or the medicine says, it can have side effects like Om said, bleeding, right? I think another thing that people really wanted to know about is that so we are taking oral contraceptives, right? And what are other medications? Do the people who take it have to be concerned about their medications?
Yeah, there are drugs that can decrease and increase the effects of oral contraceptives. The first one is antacid drugs. You may heard like many drugs should avoid antacid, right? So antacid drugs can affect the absorption of oral contraceptives, so which can lead to low levels of drugs in the blood. Another mechanism is some drugs can increase the metabolism of oral contraceptives, making it inactive in the process. For example, like phenytoin, prednisolone, steroids, anti-HIV, and St. John wort. Yeah. And some drugs can stop the metabolism of oral contraceptives, leading to high amount of drug in the blood causing more side effects, such as clarithromycin is the antibiotics, and the ketoconazole, which is antifungal, and verapamil, which is about heart drugs.
I see. So basically, it does interact with other medicine คือตีกับยาอื่นอยู่แต่ว่าไม่ใช่ทุกชนิด not all of it. So what we're trying to say here is that if you go to a drugstore or if you go to a hospital to get diagnosis, you have to tell them that you're taking oral contraceptives, so they know, and they will maybe change the dose, change the medications, or give you extra medications. Our point is that we want you guys to tell the doctors and the pharmacists that you are taking oral contraceptives. It is very, very important. And what about we've talked about medications, we've talked about taking oral contraceptives. How about implants? I've heard that there are implants, right? You could put it in your body.
Implant ฝังเนาะ
Yes.
ฝัง contraceptive implant. This is the most effective method to birth control because it's implant. So you don't forget.
You don't have to do like 28 days, 21 days and count 1, 2, 3, 4, 5. Just put it in there.
It's in your body.
Yeah.
So doctor will implant a small rod contain a drugs, a hormones. Position is in your arms. Your arms. The rods in your arm. Then the drug slowly released into your bloodstream. When it is empty, the doctor will change a new rod for you. You can select that you will continue or stop. If you want a baby, if you want to you plan to have a baby, you will remove it. Stop the implant.
It can be like the length, the duration of it can be up to years, like if I can remember.
The duration it depends on
which
brand.
Which brand you choose?
Brand.
Like
some brands advise 3
years, like,
and
right. Yeah.
I'm not sure some brands 5 years.
Yeah, I've heard that too.
5 years. But I think 5 years is so long. The common side effect will come when you implant because you cannot ควักมันออกมาคือไม่สามารถ stop มันได้อะเนาะcommon side effect are irregular menstruation, mood mood swing complication at the implant site เป็นแผลบวม inflammation infection irritation at the implant site and headache something like that is the most effective birth control คือต้องบอกกันว่า all those side effects it's not going to happen like 100% every time you do it คือมันเหมือนเป็น risk it has a chance of happening but yeah คือมันก็ไม่ใช่ทุกอันที่มันจะเกิด side effect not side effect like ผลข้างเคียง
depends on the person
depends on the person depends on the method depends on the brand it depends on many things it's not like we've said that so many side effects I'm not gonna do implants anymore no we're just warning that this could happen ก็แบบเหมือนเป็นความเสี่ยงให้เขาไปแบบให้แบบเป็นความเสี่ยงประกอบการประเมินเลือกใช้ I used to evaluate your decision that if you want to do the implants or you want to do the oral contraceptives it has มันก็มีข้อดีข้อเสียต่างกันเนาะ oral contraceptives it's not scary right you just eat every day but you have to take it consistently regularly but on the other hand if you use implants it might sound scary because you have to put some kind of rod inside here right your arm right and it sounds a bit scary but in the long term you don't have to worry about it just one time and then 3 years 5 years you change it depends on how you choose and which one you prefer there's no right or wrong and how about injections
there are many kinds and injections is one of the alternatives all you must do is go to see the doctor on the day that you make the appointment
the appointment
it is injected into the muscles common side effects are weight gain and irregular menstrual cycle there are not much side effects as the implant but the cost it will be
expensive
is higher
so basically there are so many contraceptives that you can choose from the market it depends on which one you prefer but for the female part it is finished okay and now we're moving to the male part which is condoms this is going to be a bit fun and giggling so moving to condoms
our face laugh
how do we actually use it correctly because you talked to me earlier that there are some people who write it down on the internet that do I have to use it like this can I use it like that can I put it over the testicles there's so many questions and we want to give the information for the viewers especially the male viewers of course
condoms are another alternative method that is very effective but some people still use it incorrectly and irregularly this thing cause effectiveness of condom to decrease moreover during sexual intercourse condoms can be ripped due to friction this can be solved by using lubricant
สารหล่อลื่น lubricants
but lubricant must be correct type and compatible with condom for extra precautions women should also take emergency pill too not only does condoms help with birth control but it helps in protection against infection disease like STI sexual transmitted
infections like syphilis right syphilis herpes or HIV
so the condom is very good for the birth control if you use like condom and
pills emergency pills
it will be like effective
or contraceptives because you protect each other like the female protected their sides the male protected their sides which can like increase the chance of not getting infected and not getting pregnant at the same time so let's dig in so how do we actually use condoms
so I will tell you like how to use the first one is condoms should not be reused many people misunderstand like they use it and they like wash and they use it
มีคนอย่างนั้นด้วยหรอ
Oh, there are many like opinion in the
Yeah, I think there are many. Because there's not actually like an instruction for you to use right like correctly. So, because it does look like it's reusable. Like some people like don't know.
And only use one condom at a time. Do not use 2 layers of condoms. Yeah.
This is a very common belief. People say that 2 ชั้นดีกว่า 2 layers condom good protective ชัวร์กว่า but no the friction will makes it break right it will tear apart เพราะว่าเหมือนยางเสียดสีกับยาง
ยางเสียดสีกับยาง
มันก็ break ขาดแล้วก็ can be you will be exposed to risk that we said earlier.
Condoms must be put on the penis is fully erected. Yeah.
Okay. Fully erected only, okay?
Yes.
My boys, fully erected only. Because it will maximize the size of the condom, right? It will stretch out มันจะยืดสุดแล้วมันก็จะแบบใส่ได้พอดีอ่ะ Yeah. And
if it's not fully erected you cannot put it
you cannot put it on. True, you cannot put it on.
And in ripping the package, mouth and scissors are not recommended since it can cause damage to the condoms. Because like when you แบบเหมือนแกะซองแล้วแบบมันก็จะขาดไปด้วยกัน you should not use the mouth or scissors
คือเหมือนแบบจะแกะซอง like you're gonna rip the package but then you just rip the condoms, right?
Yeah. And after ejaculation, penis should be taken out of the vagina instantly and hold the condoms tightly so it does not cause any semen to leak out. It's very important. If the semen is leaked out, but
Even a little bit?
like, in the vagina of female,
there's a chance
have
of
the
getting
chance,
pregnant. So this is important. Don't forget to hold it after ejaculation. This is important.
Yes. When you did like sexual intercourse, I know they are emotional, like everything, but you have to think more like after.
We need to think about the consequences.
You have to think more that after this and use tissue paper to help take off the condoms because it will help the semen to not spill out. Yes, tissue. And check if there are any holes in the condoms too after you use it.
What the method to check it? What is the method?
I have heard that I don't know if it's correct or not. They use the water.
Put the water
to see if it leaks or not, right?
Yes.
It's great.
But it's not confirmed that it's not leak. Sometimes it's just a little bit of hole and water will not leak out.
So basically just check it อาจจะด้วยสายตาอาจจะ like you just said water
Put water
to see if it's leak out.
I don't know the best way to check is.
It depends on the person. Because if it really leaks, then you'll have to be how to say take action. Like อาจจะไปหาหมอหรือ take emergency pills we don't know เพราะว่าif it leaks there's always a chance of getting infected and getting pregnant. So basically condom is sort of like a weapon against birth control and against infection, right? คือมันดูเหมือนจะเป็นของที่แบบ it might seem like a very simple thing like just a plastic bag that covers your penis but ถูกไหม it's just like a plastic bag that covers your penis but the wonders คือช่วยได้เยอะมาก คือสามารถแบบป้องกันการเกิดลูกได้ป้องกันการเกิดลูกได้คือมัน amazing เนอะ it's like a magic item that you
In my opinion I want to recommend that you should not think that women take the oral contraceptive so you don't have to use condom. It's not like
yes
it's not the same like effective.
เพราะว่า oral contraceptives okay it might help in birth control but it doesn't help you with disease.
Yes.
If the person is infected with HIV or syphilis or herpes then you will absolutely get infected too even though they take oral contraceptives. So the point we want to talk about this is because we really want to raise the awareness and the importance of oral contraceptives and condoms because we see that so many teens nowadays really have birth before the supposed age คือมีลูกก่อนวัยอันควร
หรือก่อนที่ตัวเองจะพร้อม
ใช่คือ having sex is not a problem. It's okay. It's normal. We're humans. We have emotions. But having sex with responsibility is something that we all should do. เพราะว่ามันเป็นการรับผิดชอบต่อหน้าที่เนาะคือถ้าเกิดสมมติว่ามีลูกขึ้นมาหรือมีโรคขึ้นมาคือจบเลยนะคือยากนะอย่างมีลูกขึ้นมาก็ there's going to be a lot of expenses and you take care of your children and you มีโรคขึ้นมาอย่างถ้า if you get HIV infection there's no cure ตอนนี้ยังไม่หายอย่างเงี้ยคือเป็นหายแล้วผ่านเลย
You have to use the drugs
all แบบเหมือนตลอดชีวิตเนาะคือเหมือนแบบ there's no second chance ป้องกันดีที่สุด
Yeah because it's just a very short time at the time that you have the sexual intercourse but they will cause a lot of problems after that.
It's really worth it because both oral contraceptives the contraceptives and condoms are not expensive สุดท้ายนี้as healthcare professionals we want to tell you that we are always here to help you guys. It is not something that you should hide from, you know. If you really struggle with using it or you need advice คำปรึกษาอย่างเงี้ย we healthcare professionals are always here to help. You could just go into the drugstore and ask or you can go into the hospital and ask the doctors. It's ได้หมดเลยคือถามใครก็ได้ทุกคนพร้อมให้คำแนะนำหมดเพราะว่า for us it's a normal thing for human beings.
Don't be shy to ask.
We normalize these things. It's not something that is new, big or น่ากลัว right คือเราอยากส่งเสริมให้ทุกคนตระหนักถึงเรื่องนี้เพื่อที่เราจะได้ป้องกันปัญหาต่างๆที่จะตามมาภายหลังแล้วก็มันเขาเรียกจะทำให้ตัวผู้ใช้เองผู้มารับบริการเขาแบบไม่เดือดร้อนในอนาคตด้วย I hope you guys will come to ask us like freely ask us don't worry about anything we don't judge okay so this is it for today's episode so today's episode is about oral contraceptives and condoms and so mainly we just want to raise the awareness and to show you guys that it's normal to take these things and to use these things it's nothing new at all or something different and so our time is up and don't forget to like and subscribe and you can press subscribe to follow more see you guys next episode bye bye